started, and here is your question. Right. So if you have read and understood considering its surgical and optimization, kindly tell me what is the structure that you're looking at? Would you be able to identify the structure? Are you there?
Yes,
hello.
Sorry. Hello.
Yes, please. Yes.
Yes, ma'am. This is a projected image of the inside of the abdominal cavity showing the inferior mesenteric vessels.
All right. Okay, you are talking about the mesentery and the vessels, but what is it containing else?
It contains the short bowel and the large bowel loops.
Okay, yeah, intestine. So can you tell me the development of the small intestine? Development of the small intestine, please. Which vessel belongs to? Yes, please. Yes.
The small intestine, the intestines are formed by the foregut, midgut, and hindgut. Ma'am, the foregut is from the mouth to the second part of the duodenum, where the papilla enters.
Yes.
Where the bile duct enters the duodenum, and the midgut is from the second part of the duodenum to the distal transverse colon, and
Yes.
the foregut is from the distal transverse colon to the upper part
hindgut.
of the rectum.
Hindgut. You said foregut. Okay, hindgut is what you told me the last. Can you
Yes,
see this
Sorry,
blue
hindgut.
arrow? Yes. Can you see this blue arrow and this red circle? It says 5 on it. Can you please identify the structure?
Sorry?
Inferior mesenteric artery. Can you tell me what are the
inferior
branches?
mesenteric artery?
Yes, please.
Yes,
can you, is it like, do you have problem hearing me today? Can you please tell me what are the branches or what is the
yes,
area? What is the area supplied by the inferior mesenteric artery?
Or what are the branches of inferior mesenteric artery are the left colic artery, the superior rectal artery, the sigmoidal arteries are the branches of the inferior mesenteric artery, ma'am. It supplies the distal part of the transverse colon, the descending colon, and the upper part of the rectum, ma'am.
All right.
And the sigmoid colon as well.
Also identify another red circled structure, please.
Yes, ma'am. That structure is the left colic artery, supplying the transverse colon and the descending colon.
Very good. Okay. If a patient presents with an mesenteric infarct of inferior mesenteric artery, how would the symptoms be, or what would be the symptoms, or in what conditions?
If the patient,
yes, please.
The patient will present with abdominal pain, which is abdominal pain, and
among the two vessels,
probably
superior mesenteric vessel and inferior mesenteric artery, which one is more susceptible to mesenteric infarction?
superior mesenteric is more susceptible.
Okay, why?
Ma'am, because it is in close relationship with the pancreas, and in cases of pancreatitis, there can be a superior mesenteric infarct.
Can you tell me the parts of the pancreas?
Yes, the pancreas is divided into the head, neck, body, and tail.
All right. Unfinished process is part of which belongs to which part of pancreas?
It belongs to the head region of the pancreas.
How many ducts open in pancreas or open from the pancreas, and where are they located, or where do they open?
Ma'am, there are two ducts. The main pancreatic duct, also called the duct of Wirsung, opens into the posterior medial aspect of the second part of the duodenum to the ampulla of Vater, and the accessory duct also opens nearby. It contains the uncinate process. And the main duct contains the rest of the pancreas.
Yes. What type of secretions are secreted by the pancreas or the gland?
Pancreas has both endocrine and exocrine secretions. Endocrine secretions are secreted by the islet cell.
Yes.
Alpha cells secrete the glucagon, beta cells secrete insulin, and D cells secrete the somatostatin. And exocrine secretions include enzymes for protein and fat metabolism, like lipase, amylase, protease.
Right. Can you please tell me? Right. Okay, how to write? Can you tell me the development of the pancreas?
I'll get back to you later.
Okay, can you tell me the vessels which are encountered during Whipple procedure?
During the Whipple procedure, ma'am, the abdominal aorta is encountered, superior mesenteric artery and vein, the splenic vein, the left renal vein, and the inferior and superior pancreaticoduodenal vessels.
Okay. Can you please tell me concerning spleen, what is the surface anatomy?
The surface anatomy of the spleen is, ma'am, beneath the 9th, 10th, 11th rib on the left side.
Right. Can you tell me the structures which vary during splenectomy, which are susceptible to injury during splenectomy? Can you name the structure?
Tail of pancreas is.
Yes.
Tail of pancreas is susceptible, ma'am.
Yes.
For injury during a splenectomy.
The patient present if by chance you have injured the tail of the pancreas?
Patient will present with pancreatic enzyme leakage from his drain if there is a drain cap, and a peritonitis will be there due to
Can you tell me the blood supply?
Of the pancreatic.
Please tell me the blood supply of the spleen.
The splenic artery supplies the spleen, which is a branch of the celiac tract.
Can you please tell me the course of the splenic artery?
The splenic artery arises from the celiac trunk, then it travels towards the left over the body of the pancreas, behind the stomach, from which it is separated by the lesser sac. Then it travels in the renal ligament and opens to the hilum of the spleen, supplying the splenic artery.
Can you please tell me the organs which are supplied by the splenic artery? Other than spleen?
The splenic artery yes, ma'am. It also supplies the stomach and the pancreas.
Pancreas, very good. Okay, one last bell has gone because we were slow. Right, if you can identify this image, both A and B, and the labeled structures as well.
Image A is the angiogram of the trunk, ma'am, from the thoracic, from the abdominal aorta.
Which trunk? Celiac.
The celiac trunk, yes, ma'am.
Yes. Can you identify the marked structures A to F, please?
Yes, sir. Structure A is the hepatic artery, a proper hepatic artery. Structure B is the common hepatic artery. Structure C is the left gastric artery. Structure F is the splenic artery. E is the celiac trunk, and D is the gastroduodenal artery.
Moving on to picture B. If you can identify.
यार बात सुने, वो मच्छर या मुझे खा जाएंगे.
Is probably the angiogram of the.
Sorry, Dr. Rohit, by mistake I. Yes, please. A
Yes, ma'am,
is
no
what?
problem. It is. A is the probably the ileocolic artery.
Probably.
I don't know.
Yes, others.
I'm
All
not
are
sure,
giving
sorry.
exam. Yes, come.
E is probably.
Yes.
Yes, ma'am.
Join. Others.
E is the trunk for the jejunal arteries, and F is for the ileal arteries. B is for the ileocolic artery. I can't remember what A is now.
Yes, who can?
That will be a problem. No.
Dr. Muhammad Ali or Dr. Khanna?
Right colic artery, probably, ma'am.
Yes. Dr. Snail, you have already done this. You tell, please.
Yes, ma'am.
Please. Yes. Correct. Help Dr. Rohit. Come on.
Yes, ma'am. The diagram on the right, ma'am.
Yes.
Hello.
First tell the B, picture B, because he told kind of picture A. He's stuck with picture
Right
B.
colic. B is right colic. Yeah.
D is which vessel is D?
Yeah. D is superior mesenteric artery.
Okay, and A is, if you can identify all the structures, please.
Yes, ma'am. D is superior mesenteric. A is middle colic. B is right colic. C is ileocolic, and F is
Dr. Snehal
it
can
must be superior rectal, but
yes.
Yes,
Who
ma'am.
knows? Yes,
Ma'am,
please.
B is.
Yes, please.
Yes, ma'am. B is right colic. A is middle colic. E is left colic. And F is inferior mesenteric. C is ileocolic, ma'am.
Ma'am, why
A
it look like B
is the
is
right
common
colic
iliac?
artery.
Sorry?
B is the ileocolic.
Okay. Who was saying something? It looks like what?
A is the right colic artery. B.
Yes.
Common iliac.
Okay.
Like it look like it's the terminal branches of the aorta. B and F.
we can see the vascular arcade. It has to be a small intestine,
Yeah.
right?
Okay. D is
It can't be
superior.
aorta. But the problem is that we cannot appreciate the superior.
This D is superior mesenteric artery, right?
That is superior.
Mesenteric
Yes.
Superior mesenteric artery.
Yes.
Yes, ma'am.
And then A is right colic artery.